Hello, everyone. My name is Audrika Glover Hill, and today we will be talking about the education process. The learning outcomes will be that the MSN, student nurse educator, will be able to identify the steps in the education process, know the difference between teaching and instruction, understand behavior growth changes that occurs with learning, and understand how nurse educators are influenced by educational theories. The education process is a planned course of action. It involves teaching and learning. It involves two individuals, the teacher as well as the learner. Both must understand the process of two-way communication. It also involves growth between the teacher and learner and is much like the nursing process. The education process steps are the same as the nursing process. The first phase process is assessment. Identify learning needs, readiness to learn, learning styles, and the individual needs of the students. It's important for students to do self-assessment, also to get peer assessment as far as the assessment of their needs, and also the instructor to assess their needs. Planning is developing a teaching plan based on outcomes to meet individual needs. This is done to help students to critically think, to know about basic principles. Some examples will be like a first level student will not have the same planning as a fourth level student will in certain skills. Implementation. Performing the act of teaching using specific instructional methods and tools. This can be done through tests, new ideas, skills labs, lectures, and again, tests, multiple tests. Evaluation. Determining behavior changes in knowledge, attitudes, and skills. This can be done through survey and feedback from different students. In the teaching and learning process, there must be motivation. This can be done by personal goals, relationships, having strong relationships with families, identifying fears and anxieties, because we know sometimes that fears is what really motivate us to do things. Also, learning satisfaction and success. Some barriers to teaching and learning can be a lack of time, a lack of motivation. It can be a negative environment, a lack of competence, and it can also be a lack of competence. So, in teaching versus instruction, teaching is the act of instructional activities used to identify student learning needs, readiness to learn, and learning style. This is done through classroom, online, computer lab, skills lab, and also in the clinical setting. Instruction is the component of teaching skills that utilize cognitive, psychomotor, or the affective domain. An example as I can give is used with care plans on a patient that may have congestive heart failure. The cognitive is that the client gives side effects of what the medication is. Affected is the client shows feelings and attitudes about the medications. Psychomotor can be that the client perceives new health practices such as checking their weight every day. Learning is the action by which skills, knowledge, and attitudes are acquired to alter behavior. Now, with the example I just gave, this client is learning to actually manage their heart failure. That's a learned trait to change behavior. So, the paradigm shift have focused in increasing technology and in nursing science. Nursing educators have adopted several educational theories. So, nurse educators are shifting from teacher based curriculum to more student centered learning. This is driven by technology, evidence based practice, which helps promote critical thinking, problem solving skills. Now, that is the end of our lecture for the education process.